Yep.
All right, guys, Dr. Gilmore here. As you can see, I've managed to lacerate my finger, left hand, middle finger. We're doing a little work with the knife, and I dropped measuring tape, and sure enough, reached for it, and I've got about I don't know, it's about half a centimeter, maybe, I'm sorry, half an inch laceration to the tip of that finger. And nice bright red blood, so I managed to catch an artery in there. So, you know, I could go to an urgent care or emergency room somewhere and get some stitches, but, you know, I started thinking, what if I was out in the woods somewhere, or out on a construction site or campsite somewhere, and I did this? What would I do? Well, what I would do is I would wrap it up and I'd hold pressure on it. But if I could find some duct tape like this right here, and this is just good old-fashioned 3M brand industrial duct tape, I'd cut a piece of duct tape off, and I would use it to repair this laceration. And the fact of the matter is, there's a lot of research that shows that duct tape, in an emergency situation, can make a pretty good dressing. So, here we go. I'm going to cut a piece of duct tape off of here. Let's get rid of that. The DW does not know that I am home out here. Well, she knows I'm home. She doesn't know I'm out here with a lacerated finger. She would probably insist I go have stitches, but instead, I think we can just handle this. I am up to date on my tetanus status, so I don't need to worry about that. A tetanus shot's good for about 7 to 10 years. This was a pretty clean cut, so I'm just the knife was clean. It's not like it had a lot of dirt on it. I'll put this little piece around it next. There we go. Maybe I can cut one more little piece. Obviously, one of the things I wouldn't want to do would be to actually cut myself yet again, putting the duct tape on, right? So now I've got fairly good duct tape dressing. It's holding the laceration in place, and doesn't feel too tight. Feels snug, and the bleeding's not coming through. So I think this will probably hold just fine. If I can keep this on here for a couple of days, I'll be just fine. Well, now if you're, if you've got ready medical care, and you want to go get something like that sutured, well, certainly you could, and that's what we would officially, that's what we would recommend. But let's say you're out in the wilderness somewhere, you're out on a campsite again, or you're far away from medical care, you'd be surprised what you can do with duct tape. All right, guys, thanks for watching.
Stay tuned for the Meta 7 video.
All right, we're gonna be live, and you're gonna tell me about Meta 7, but tell us how you were feeling before you started Meta 7.
6 months ago, I was doing well in terms of rehabbing from my stroke, but my energy level was low, and it was very frustrating. I would spend 3 or 4 hours a day just sitting on the couch because I didn't have the energy to do anything. Would take naps, and I could get things done in small bursts. Now, I haven't taken a nap in 6 months. I haven't, I go to bed at 9, wake up at 4. I'm working a new job, substitute teaching. I'm on my feet all day. I'm working in the backyard doing physical labor. My wife won't let me use an electric chainsaw, so I'm having to cut everything by hand. And I just don't, anytime I sit down on the couch for 5 minutes, it's like, okay, I got to get up and do something.
You don't want to sit around. You don't feel lazy. You don't feel tired anymore. No. All that's gone. And do you feel shaky, jittery, nervous, anything like that on the Meta 7?
I haven't noticed any of that.
All right.
What I've noticed is I had a stroke in June, and I'm back to pre-stroke activity level.
That's fantastic. Now, probably some of that we can attribute to the fact that the stroke has healed some.
Sure.
But what we were really focused on before was you were just dealing with this profound fatigue. And when you started the Meta 7, that reversed almost immediately.
Yeah, the fatigue was debilitating. I mean, it was like I couldn't just sit there and work on my computer. I mean, I had to sit on the couch and watch TV and do nothing.
Fantastic.
And now that's all overcome.
Fantastic. Thanks for sharing with us.
Yeah, you bet.
Come on, Fishy.